Hi, I'm Meridith Sonnett. I'm the Chief of the Division of Pediatric Emergency Medicine at New York-Presbyterian Morgan Stanley Children's Hospital. Our first encounter in the emergency department with families and with children seeking care is generally under tremendous duress. They are stressed, they're there for an emergency situation, and our first job is to be able to connect with them in a way that they can trust us and to make them feel safe. And that comes from a lot of things. It comes from how the physicians and the nurses and the folks taking care of the patient and family interact with them, but also we are incredibly, incredibly blessed with having a beautiful new emergency department. We designed the emergency department, and it took us years to make the absolutely most perfect design. And we designed it with children and families in mind. We wanted them from the minute they came in to feel comfortable. We have probably the most high-tech array of games and distracting activities for the children in the patient lounge, which is the area that they wait before they get seen. And then every single patient room is an individual room with glass sliding doors. It's quiet, it's serene, there are television sets, other sorts of games to be played, and it really is able to bring the level of anxiety, both of the family and the child, down. We're also very fortunate to have a very comprehensive child life program, and the child life specialists work with the children, and it is just remarkable to see what they can do. We have a huge effort around reducing pain in children, and that's one of the nationwide efforts, particularly in emergency departments, is that children really do experience tremendous pain, and it's important to address that. So we have a pain initiative that the child life specialists work on with us. In the emergency department, we see a wide spectrum of illness and injury, from the worst, most imaginable disease or injury to things like an ear infection and a sore throat. And after I've had a particularly hard day where there perhaps was not a terrific outcome, or there was a child that was newly diagnosed with a terminal illness, what allows me to make it through the day and get up the next morning and come back is multifold. It's being able to connect with the families, being able to provide some compassion and support in an incredibly, incredibly hard time. And it's probably one of the most humbling experiences for any human being. And you really feel like you've accomplished something, and that because you've been able to connect with somebody in that way. I think being a parent puts you in a special place when you're relating to parents and to children. First, you have your own experience with your own children, and so for me and the rest of us who have kids and work in the emergency department, we immediately relate to children. We had children because we love them, and when we take care of other people's children, I think we all have in the back of our mind, this could be our child. And I think that makes a really special connection. And I think the families feel that. And our physicians, me included, feel a special bond with the parents. We know what it is to have a sick child. We know what it is to be terrified that your child may not be okay. And we know what it feels like to be in a helpless situation where you're relying basically on strangers, people that you've never met before, to help your child get better. Or even save your child. And in the emergency department setting, because of that environment, the link and connection with the families is absolutely extraordinary. They have to dispel any barriers that might make them have an issue with connecting with people, and the same for the physicians. You know, we jump right in the middle of the fire, and do what we can, and it really creates a special bond. And I think that being a parent allows me to make that leap even more quickly.